The Minnesota State High School League and the Medtronic Foundation are pleased to present Anyone Can Save a Life, a first-of-its-kind emergency response program for after-school practices and events, designed to save lives from sudden cardiac arrest.
March 24th, 2005, our son Jarrett was got invited to play in an all-star basketball game in Duluth, Minnesota. He just finished playing in the state basketball tournament down here in the cities, and he was very excited about this basketball game. It was all the all-stars. It was from the all-stars from the Duluth area versus the all-stars from the range area up there. And of course, we lived in Grand Rapids, so he played for the range team. The game was at Duluth Central. The gym was really hot that night, and what they did is they played 5 minutes on and 5 minutes off. The players. It was a hot gym. He played, and he looked like he was struggling a little bit out there. He was sick before the game. He had strep throat, but we thought he was doing better, and there was no way stopping him from playing that game. During halftime of that game, the athletes went downstairs underneath the stands there, and we didn't think nothing of it. And then they called for a doctor, asked, is there a doctor or nurse in the house? And we kind of didn't pay attention to that very much. And then a few minutes more, they asked again. And then, I'm not sure how many minutes, it seemed like forever, they asked for us. We went down underneath the stands, and there was Jared. He was laying down on the ground. He was blue and gasping for breath.
Well, I mean, there wasn't a trainer there, and the coaches didn't know what was going on. They just thought it was maybe, from the heat, because it was so hot in there. They just knew he collapsed, so they didn't really have any idea what was going on.
We know he was in trouble. It looked like he was in serious trouble. We asked if anybody called 911, and nobody had even called 911 yet. At that time, we still didn't know he was having sudden cardiac arrest because he was actually gasping for breath, so we thought he was still breathing, but I guess we found out later that gasping is actually a sign of sudden cardiac arrest. We helped start CPR. There was a nurse came down there, and we started CPR. We waited, and finally the ambulance came, and they put their AED on him and tried to revive him, and he never did come out of it. We got to be there and be part of it and basically watch our son die.
Sudden cardiac arrest, or SCA, is a leading cause of death among Americans. Sudden cardiac arrest happens to 250,000 or more adults in the United States each year, and to 100 to 150 high school athletes. In the high school setting, sudden cardiac arrest could happen to a student, a coach, an official, a parent, or a visitor. It is important that everyone, adults and teens, learn the early warning signs and how to recognize and respond to a cardiac emergency.
Well, there are a number of different causes of sudden cardiac arrest. They can be structural causes, they can be genetic causes or inherited causes, or finally they can be situational circumstances that impact the heart. An example of a structural defect would be if the heart itself is very thick, a condition that we call hypertrophic cardiomyopathy. Some children have inherited types of heart abnormalities. An example would be congenital long QT syndrome. And in that circumstance, as many as 50% of family members may also have the condition. And sometimes situational circumstances can lead to the heart arresting. An example would be if the heart was hit by a very hard object like a baseball or a hockey puck. That condition we call commodio cordis. And sometimes the heart can be affected by medications or by illegal drug use, especially amphetamines or cocaine, the drugs that speed the heart up. Those can impact the heart. So overall, there are a number of different causes of sudden cardiac arrest, and it's important for family members and children to seek medical attention if they suspect they may have a congenital or an inherited condition.
Many individuals have cardiac abnormalities that go undiagnosed. That's why it's so important to learn the signs and symptoms of a sudden cardiac arrest. Be suspicious if you notice fainting during exercise, unusual shortness of breath, profuse sweating, extreme fatigue or loss of muscle control, or complaints of chest pain or discomfort during exercise. Parents, coaches, and athletic trainers should be aware of these signs and symptoms and take the time to educate their teams on what they are. SCA is a condition in which the heart stops abruptly, without warning, usually caused by ventricular fibrillation, an abnormality in the heart's electrical system. In this state, the heart fails to pump blood to the body's other vital organs. Left untreated, death follows within minutes. SCA typically strikes older adults, but it occasionally affects people in their 30s and 40s, and even teenagers, who may otherwise be fit and healthy. Electrical impulses in your heart trigger rhythmic contractions that circulate blood throughout your body. Conditions can occur that result in a chaotic heart activity known as ventricular fibrillation. When this happens, oxygenated blood stops flowing to the brain and other vital organs. The victim rapidly loses consciousness. Ventricular fibrillation is the most common cause of SCA. The treatment for ventricular fibrillation is defibrillation, an electrical shock delivered through the heart using a device called a defibrillator, or AED. Unfortunately, some victims may not exhibit any symptoms before the SCA occurs. For every minute that passes after SCA, the chance of survival diminishes by 10%. Defibrillation is the only proven treatment for sudden cardiac arrest, so a quick response is crucial.
Sudden cardiac arrest doesn't always occur with sports. It's often that it does because this is the most intense time, the time that the heart is working the hardest and the time that it puts the largest strain on the heart. Some of the kids actually do have symptoms and either they don't know it or they don't admit to those symptoms. Some of the other defects can be detected by screening either by knowing the family history, by pediatricians, family doctors, coaches, teachers, parents being aware of the symptoms. So in those cases, there can be the potential to discover them before something happens. Unfortunately, there is a large subset of the kids who we will not know about the cardiac defect until something bad does happen.
The Minnesota State High School League has a policy in place that requires athletes to have a pre-participation physical exam every 3 years. In the second and third years after the physical, the student and parent must complete a health questionnaire that addresses the student's health history. The questions on this form alert parents to risk factors commonly associated with SCA. Students may not participate until their pre-participation questionnaire is on file with the athletic office. A recent MSHSL survey indicates that 90% of Minnesota high schools have at least one AED on site. However, 60% do not have a well-defined action plan in place to handle after-school emergencies. One of the primary purposes of this program is to provide assistance to schools in creating and sharing an emergency action plan for quickly assessing and using AEDs. By helping schools implement Anyone Can Save a Life, the Minnesota State High School League and the Medtronic Foundation hope to raise awareness about SCA among teachers, coaches, administrators, students, and parents. This comprehensive program will cover everything from recognizing the signs and symptoms of SCA to the latest in CPR and AED education, and in the development of emergency response plans. Why implement Anyone Can Save a Life in your school? For students, SCA is a growing health concern. In the past year in Minnesota, there have been 5 known incidents of SCA in student athletes. All of these students appeared healthy and had little or no indication that there was a health problem. It will create an awareness of the importance of screening through the use of the Student Health Questionnaire, and it will teach students a valuable life skill that will equip them with the necessary knowledge to be the future generation of responders. Additional reasons to implement this program include the fact that schools are a community gathering place of adults who are a high-risk population. It will strengthen the chain of survival by educating staff and students. Developing an emergency action plan and training staff and students on what to do in a cardiac emergency is crucial. Remember that AEDs do not replace 911. Your staff and students should be aware of the response protocol and be able to perform CPR and use the AED until an ambulance arrives. It is better to put the AED on and not need it than to not and waste precious time. Every second counts. You have 5 to 6 minutes to respond or the victim will die. Survival rates decrease by 10% with every minute of delay. When SCA occurs, chest compressions and the use of an AED need to start immediately. Don't waste precious time trying to figure out what may have happened. You need to recognize SCA when it happens and take action immediately.
As an AD, oftentimes you see parts of games, and I happened to, at that time, I saw Dale go down, and I was across the gym up at the top of the bleachers. And I just bolted because the way he went down hard. And I was literally the first one that got there. And he was seizing, and that's, Lindsay came out, and it was, I mean, quickly, boom, boom. We had 2 nurses, the trainer, Lindsay, myself, and he was in serious trouble. When I look back and I reflect, it's pretty empowering to see a student, a youngster, to step out of the stands and be willing to step up and to help. And you know, at that time, she doesn't know what the issue is, but she knows that she has training. And that showed me the power of education, the power of training. Because the reality is, most of this, I think about it, it's going to happen to a coach. And it's going to happen to a coach that's out on that back field, you know, with the 9th graders. And it's going to be just as important that those kids know how to respond, because one of the things that I really reflected on in this is that I could have been, if we hadn't had, number one, if Fridley wasn't a progressive community where they had the AEDs and the training, and we didn't have people like Lindsay and the nurses and the trainer who had been trained and felt confident to respond correctly, I would have been reflecting not on, wow, how great this was, look at what happened, we saved the person's life and people feel good. We would have had a bunch of people who would have felt terrible and would have lived the rest of their life thinking, what could I have done? What did I do wrong? What could I have done better? I would have been one of those people.
At this time, please distribute the response protocol worksheet and review the lead responder's responsibilities, which include initiating CPR, enacting the 911 team, and the AED retrieval team. Lives will be saved by calling 911 immediately, starting CPR, retrieving the AED, and having EMS transport the victim to the hospital for follow-up care. The best way to provide an immediate response at after-school practices and events is to establish student response teams. These teams will activate the steps to save a life in a cardiac emergency. The first team is called the CPR AED team. This team will start chest compressions immediately and use the AED when it becomes available. The coach or staff person will be the lead responder on this team. The 911 team will call 911 and provide the dispatcher with the needed details of the emergency. This team will also meet the ambulance at a predetermined location and will call the school's emergency contacts. The AED retrieval team is responsible for getting the AED and bringing it to the victim. This team will need to know the exact location of the nearest AED. This team will also find the athletic trainer if one is available and make sure this person gets to the scene immediately.
I think one of the big questions that almost every school has that we've been involved with is the safety of the device. What if I use the device incorrectly? What if I shock someone and they don't need it? Can I cause damage in such a situation? Well, as it turns out, these devices are fully automated external defibrillators, so you can't use it incorrectly. All you need to do is learn how to put the paddles on correctly. The machine will do everything else. If the child has an episode of sudden cardiac arrest, it'll be very clear. The patient will be, or the child will be without a pulse and not breathing. The device will allow you to determine what the rhythm is, and the device will really tell you whether it's appropriate to do a shock or not. And if you do a shock in somebody who has ventricular fibrillation, I think there is a reasonable chance you will be able to shock the patient back to a normal rhythm. So really, for people who learn how to do this, it's a foolproof method. The machine, you do CPR, and the machine literally will talk you through everything else.
At this time, review the location of the AEDs on your school campus. If arranged, conduct AED training at this time with your local EMS. Thank you for taking the time to learn about sudden cardiac arrest and anyone can save a life. By following these steps to implement your school's emergency action plan, you will be contributing to a statewide effort to consistently and effectively respond to victims of cardiac emergencies, with the ultimate goal of saving lives. At this time, please conclude with the Friends and Family CPR Anytime, Hands Only training.